We will now demonstrate exercises which are commonly prescribed after a total knee replacement. We recommend that you practice these exercises before your surgery to build up your muscle strength and to become familiar with these exercises. Before we begin, let's review some common guidelines about exercise in general. First, you want to avoid holding your breath. Next, it's important to discontinue exercise if you're experiencing any sharp pain or discomfort. Consider using ice after exercise to control swelling. And finally, start by doing only 10 repetitions of these exercises 1 to 2 times a day and progress as you feel like you can tolerate. Let's begin with the first exercise, which is an ankle pump. While lying down with your legs straight, flex your foot up and back down, moving through full range of motion at your ankle. It's important to move slow. You may experience a stretch in your calf muscle, and it's also important to keep your knee as flat as possible. The next exercise is a quadricep set. Your quads are your thigh muscle on the top of your leg. To tighten your thigh muscle, press down, flattening your knee to the mat. You should also notice that your heel unweights from the mat slightly. Hold for 5 seconds and relax. And do that again. Tighten your thigh muscle, pushing your knee down to the mat. Hold for 5 seconds and relax. One more time. Tighten your thigh muscle, flattening your knee to the mat. Hold for 5 seconds and relax. The next exercise is a straight leg raise. To begin, bend your opposite knee so that your foot's comfortably on the bed. To start the exercise, first, tighten your thigh muscle. With your knee straight, lift your leg off the mat about 6 inches and then back down. And relax. Again, start by tightening your thigh muscle, keeping your knee straight. Lift your leg off the mat, back down, and relax. One more time. Tighten your thigh muscle, flattening your knee, lifting your entire leg off the mat, remembering to breathe, back down, and relax. The next exercise is a short arc quad. To do this exercise, you can use a coffee can or a towel or pillow roll at home. Place the bolster underneath the leg. To do this exercise, tighten your thigh muscle so that you straighten your knee over the bolster. Hold for 5 seconds and relax. Again, tighten your thigh muscle, straightening your knee over the bolster, holding for 5 seconds, and relax. One more time. It's important that you don't lift your thigh off the bolster, just straightening your knee. And relax. Good. The next exercise is seated knee flexion. To perform this exercise at home, start by sitting in a chair which has arms. We recommend a chair of an average height so that you can have your feet comfortably on the floor, and that it's a firm surface so it's easy to slide forward and back. To begin this exercise, use the muscles behind your knee to bend your knee, sliding your foot back. Bend your knee as far back as you comfortably can. Hold up to 30 seconds. And then relax, sliding your foot forward. Again, use the muscles behind your knee to bend your knee, sliding your foot back underneath you. Go as far back as you comfortably can. Hold that stretch for 30 seconds. And relax. To increase a stretch to your knee, Start by performing that same exercise using your leg muscles to bend your knee. Once you've reached your limit to bend, plant your foot on the floor. Use your arms to scoot your hips slightly forward in the chair. Once you reach a point where you feel a stretch in your muscles, hold that for up to 30 seconds. Then relax your leg and use your hands to slide your hips back onto the chair. Again, bend your knee back to a point where you feel a stretch. Plant your foot. Use your arms to bring your hips forward. Hold that increased stretch for up to 30 seconds. Then relax your leg and slide your hips safely back onto the chair.